Hello, I'm Dr. Nina Pearson. I'm a GP with Lee Vale and I have an interest in women's health. The menopause is a natural stage in any woman's life and can happen any time between the ages of 45 and 55 and be considered completely normal. It does have a tendency to follow a similar age in families, so it's always worth checking with your sisters and mother at what stage they went through the menopause, because it does tend to follow a family trend. The menopause itself is when the periods actually stop. And for some women that can be sudden, and it's only with hindsight that you can track when your last period was. But for other women, the periods can become irregular for quite some time before they actually stop. The periods can also become heavier and prolonged. The important thing is to track what's happening with the bleeding if you think things are changing. You can use a simple diary, an app on your phone, or you can look at the NHS Choices website, which has some very good information on the menopause, and you'll be able to find a menstrual diary on that website if you look closely. So tracking what's happening with the bleeding is helpful. It gives you some sense of what's happening. And certainly it's helpful to do this for 3 to 4 months to see if there's a pattern emerging. In many ways, having bits of spotting in between periods is of more concern than having periods that are irregular or prolonged. But do take a note and note this for 3 months, please. Other things that can happen at the menopause are a number of other symptoms, such as hot flushes, changes in memory, body aching, difficulty sleeping, and mood changes. And again, you could note these in a diary. There's some excellent information provided in various sources for women to read. And in particular, women's magazines do cover this very well. So I would commend you to read anything that's within your usual circulation of material. The NHS Choices website gives a very good summary of the associated symptoms and options for treatment around the menopause. And for more detailed information, then you can look at the womenshealthconcerns.org, which is an independent website which goes into more detail. The menopause is also a great time to take stock and look at yourself, your health and your well-being, and ensure that you're looking after yourself well. So I would commend you to have a look at your own diet, think about your weight. If you can access a blood pressure monitor, then check your blood pressure and see what that is saying. And I would also encourage you to book any screening tests that you are due for. So, for example, cervical smear. If you're called for your mammogram beyond the age of 50, then do book that promptly, please, because it is important to get those screening tests done. Also, if you've not had screening for diabetes or had your cholesterol checked in the last 3 years, again, that's a good thing to do, and you can book an appointment through your practice to have a health check done on those things. And then once you've got some results and some advice from the health professionals, you can start to make some adjustments to your lifestyle if that's what's appropriate to do. So, armed with some background information and a diary of what's happening with your bleeding and your other symptoms, if these are troublesome, then it is an opportunity for you to book an appointment with a health professional to discuss those, and you are well informed to take your decision making forward in conjunction with your health professional about whether there's any treatment needed and what you would like to try if that is an option for you. I would also commend you to keep up to date your personal contact details with your practice, So if you change your telephone number, if you change your address, please update that promptly so that the practice can contact you with any screening opportunities that are coming up, and that you are able to access those promptly. So do please pursue the suggestions I've made, NHS Choices website and the Women's Health Concern to find out more information so that you will know more about the menopause and how that relates to you. Thank you.